Hi everyone, my name is Ozzy, and I'm a core volunteer of a group called Mapbeks, an online community of volunteers advocating for LGBTQIA representation and inclusion in various online mapping platforms like OpenStreetMap. One of our main projects is the HIV Facilities Map, an initiative that aims to put up-to-date information on all HIV and AIDS testing and support facilities all over the Philippines on OSM and create a publicly accessible online directory of these facilities. Let me give a short background on the HIV and AIDS situation in the Philippines to show how important and urgent this initiative is. According to the HIV, AIDS, and ART Registry of the Philippines, a report by the Department of Health, the country has recorded around 77,625 cases of HIV infection since 1984. From January to March 2020, 2,818 new cases of HIV infection and 197 deaths were recorded. That's almost 32 new HIV infections and 2 patients dying from AIDS-related illness per day in this year alone. That indeed is an alarming rate, and yet this only accounts for confirmed cases and those that were reported to the DOH. Hundreds, maybe thousands more go undiagnosed and unreported. Some of the factors that compound the HIV pandemic in the Philippines are lack of sex education, a culture that stigmatizes people living with HIV, low condom usage among sexually active individuals, and difficulty in finding and accessing testing, treatment, and support services. The DOH, as well as several nonprofit organizations across the regions, have mobilized their resources to help curb HIV infections through ramped-up education, testing, and treatment. Several government and private facilities have been set up all over the country offering these services. We think it could become a challenge for any Filipino to find the nearest or even cheapest facility. Mapbeks HIV Facilities Map aims to augment the country's HIV and AIDS program by creating an up-to-date, validated map consolidating all government and private facilities that offer these services, including testing centers, primary healthcare units, and treatment hubs. For this project, we applied and were able to secure a grant from the OpenStreetMap Foundation for an 8-month project. This funding is being used mainly to conduct public events, mostly mapathons and datathons, with the aim of getting as many volunteers as we can to complete and validate our database of HIV facilities. So far, we've been able to collect up to 628 facilities, along with their contact details, addresses, and geographical locations. Through datathons, we compiled other important information such as services, fees, and operating hours. In a span of 5 months, we were able to increase the database information by 30%, and this includes more than 200 new facilities with location data, 100 facilities with phone numbers, email addresses, and websites, and we were able to partner with more than 100 LGBT organizations and AIDS service organizations in our events. Currently, we are validating the contact and services data, which involves volunteers calling each facility one by one. We were able to launch our HIV facilities and support map with the help of UP Babaylan, TLF Share, the Red Whistle, AIDS Society of the Philippines, HIV and AIDS Support House, and PLHIV Response Center. Reports directly from hubs are being shared to Mapbeks in order to update online information through the map. We have added 200 plus HIV facilities already on OpenStreetMap, and this data has been useful especially during the lockdown. The Red Whistle collaborated with us to launch the AR Bayanihan project, a directory and map that uses our data to show the nearest treatment hubs in a given area. This enables people living with HIV to have their medications ordered and delivered from the nearest hub. To date, the current AR Bayanihan map has reached more than 47,000 views and is being used as a reference map by major HIV/AIDS service organizations. The data we have being literally the latest and greatest database of HIV facilities in the country can be a useful resource for organizations and policymakers to aid in their programs. For example, our data has revealed that Metro Manila has the largest concentration of HIV facilities, with one HIV facility for every 3 square kilometers, while the Bangsamoro Autonomous Region of Muslim Mindanao has only one facility per 4,179 square kilometers. Batanes has no identified treatment hubs or testing centers, as is the case in many other rural areas in Mindanao. We are planning to expand the services of the HIV facilities map to cater to other special needs of the LGBT and PL-HIV community. We are now tapping other organizations like Mental Health Awareness for mental health facilities to be added to the map. Concurrently, we are crowdsourcing legal and housing support facilities from our networks to be added to the map, and maybe in the future, employment opportunities for them. You may visit the map at mapbeks.org. The issues of the LGBT community does not only concern that of equal rights or discrimination. It spans transcendentally through our everyday lives, through education, livelihood, and especially health. Through Mapbeks, we hope that we are able to help others by providing timely and updated information, not just for our community, but especially for the underrepresented and the underprivileged. Thanks for your time and have a good day.